Hi, everybody. We are back for part three, which is stages and phases of labor. Labor is divided into four stages. The first stage is all about the cervix. The second stage is all about pushing out the baby. The third stage is about the placenta. And the fourth stage is about recovery and bonding. So let's go to first stage. As I said, this is all about the cervix. Cervix has to dilate so that the baby can get out of the uterus, right? I mean, that's the first stop on the journey. It is divided into two phases. There's latent phase. Mostly what you need to know about that is it takes a long time to get through latent phase. It could be 12 hours, it could be more. And the cervix has to progressively open and thin out from 0 to 5 centimeters. At this time, mom's usually uncomfortable, but it's not unbearable. So there is pain with first stage. And some moms will get look a little more like they're in active phase at 3 to 4 centimeters. But you have to give them time to get to 6. Patience is the key to management of latent phase of labor. I try not to check people all that often during latent phase because they tend to get discouraged. They focus on those numbers, the centimeters, and that's only part of the equation. The cervix has to thin, has to soften, has to move forward before that dilation is going to be more rapid. So that's what the stage is all about. She might be excited because labor is finally here. She's finally going to get to meet her baby. She knows it's going to happen. She might be very talkative. She wants to talk about her experience. She might be on Facebook or Instagram or TikTok making a video in labor. And usually support people are really excited and they want things to go. Patience. You have patience. You educate your patient to have patience. You educate the family to have patience. And maybe you have to remind the providers to have patience. Just a little. They're usually good. But sometimes, they want to get things rolling and they are there to deliver. But the more you intervene, the more you risk screwing it all up. So, latent phase, excited, talkative. You can help mom ambulate. You can help her be distracted. Um, you can use things like the tub or the shower if they help. But she should be eating. She should be drinking. She should be doing all of the things, moving around. This is the time for that. And if moms can stay home longer during this phase, if they're not ruptured or, labor's moving a little slow, they usually labor better at home for a little while. They have to come in when they are in active phase. That's when you really need to watch them because things are happening. This is a dynamic process. Things are changing for mother and baby. Mom, it's a marathon. They've been training for it for 9 months, but it's an extreme sport. So at this point, mom is really focused on coping with contractions. It's more challenging. And this is usually between 6 and 10. Now, you can start really acting like you're in active phase earlier, like 3 to 4, especially those second time moms. Um, but this is the phase that moves a little quicker in terms of cervical dilatation. During this phase, mom will hold her hand up and say, contraction. Like, don't talk to me. She'll interrupt you mid-sentence and you're like, okay. And then she'll like suddenly look up at you and say, okay, what were you saying? And then you start over. You got to keep a tab on it. Also during this phase, this is when you really need to lean into those coping strategies. If she's using a prepared childbirth method like hypnobirthing, and she's got her earbuds in and she's trying to focus, and she says, like, she gives you a birth plan that says, don't say the word contraction or pain to me because that suggests things that I don't want to think about. Call them rushes or sort of whatever. Honor that. If she needs to get in the tub, if she needs all of those fun positions, side lying release, lunging, walking, slow dancing with her partner or even her nurse, if you want that, especially if she's alone, that swaying movement, all of those things that we talked about, we're really going to use those 5 Ps to help her cope with labor. At this point too, we want to know what's going on with our baby. So you're going to be checking the fetal monitor more often. Most providers like their patients to be in active phase before they do the epidural, but like the cutoff for that is usually 3 to 4, and some will do it at 1. All right, second stage is all about the baby coming out of the vagina. And so the uterus is out of the way now. The baby has to move down the birth canal. There are 2 mechanisms. One is uterine contractions. And the other is maternal expulsive efforts. That's your powers, right? So mom at this point, if she's feeling an urge to push because the baby is pressing on the pelvic floor, that's called Ferguson's reflex, we can assist her in pushing. And there's a couple different ways, that variations you might see in clinical. One of them is directed pushing. I don't love it. That's when you tell mom to hold her breath for a count of 10, and she should push while she holds her breath. I do think when they blow out or when they scream and it's that high pitched scream, it's counterproductive. I will tell them, take a deep breath like you're going underwater and use that force. But it's okay if they kind of grunt their way through that contraction, like that low guttural sound. That's sort of okay. That's open glottis pushing. And I don't make them count to 10. Some people can't hold their breath to 10, and some babies don't like it when their moms hold their breath for a count of 10. So 3 good pushes. And if they're real short pushes, they're not going to work as much. So I'll do the 4th. I might just say a little longer, just past that, little longer. But this is when the nurse is doing a lot of coaching. Second stage ends with the delivery of the whole baby. Then we go to third stage. Oh, nope. First, we're going to look at cardinal movements of labor. Baby does some work during labor. The first thing they do is they flex. So watch the chin come to the chest and they descend. Okay. And the stepping reflex, where something hits their feet, wall of the uterus, is going to help them kick off a little bit. Now, look, do you see that internal rotation? He's doing that because the outlet's different than the inlet. It has different diameters. Okay. And now they extend. They're getting their heads through that turtleneck, stretching their necks. And then they externally rotate. I could back it up, but yeah, they turn back so that they're aligned right. And then expulsion. Those are the cardinal movements of labor. That's how the baby operates in second stage. So beautiful and exciting. All right, let's go to third stage. Oh, stop that video. There we go. All right, here's the third stage. Third stage is all about the placenta. There it is. Some people call it the tree of life. I usually think they're a little messy and yucky, but whatever, to each his own. So third stage starts when the baby is born and it ends when the placenta is out. You want to shorten the length of the third stage because that will decrease the risk of hemorrhage. So there's 2 ways to manage third stage. I'll talk a little bit about delayed cord clamping in a second. But the first one is a passive approach. After you cut the cord, you just wait for things to happen the way they do. But that does increase the risk of bleeding. And so a more popular way to manage it, and it is a provider's choice, it will not be your choice. You're just there to assist at that point, is to actively manage it. You'll start the Pitocin as soon as the baby's out, and you're going to give her a bolus. When you start Pitocin in labor, you start at 2 units. You're going to give her 334 units in my clinical world. It might not be the same everywhere, but you're going to give her a whole lot of Pitocin. And that's going to stimulate forceful uterine contractions that help expel the placenta. The other thing they do is they put a little gentle traction on the cord, not too hard because it'll snap off, and that's a huge issue. But a little gentle traction on the cord, and then they'll tell mom, give me a little push just like you did for the baby. And hopefully you get a placenta out in like 3-4 minutes. The longer it takes, the higher the risk of bleeding. I do want to talk about delayed cord clamping because that is part of third stage. Okay, so used to be we clamp the cords right, 2 clamps right away, cut in between, get the baby to the warmer. And now the thinking, the evidence is supporting delayed cord clamping. It gives the baby like a little transfusion. It's like that last push of love through that placenta to the baby. It increases their birth weight, it decreases anemia. It gives them a little bit of extra blood, increases their oxygenation. And so what they'll do is, some people have a time limit, 45 seconds, a minute. Some people like to wait until it stops pulsating on its own. But if you do that, you're leaving the placenta in a little longer. But yeah, delayed cord clamping is more the trend. And then instead of getting the baby right to the warmer, if they're doing okay, you put them skin to skin, because now you are in fourth stage and mom's body needs to go back to non-pregnant. It's a huge dramatic change. And if she's going to hemorrhage at one point, it's going to be this. So fourth stage starts with delivery. The placenta ends either 4 hours after third stage ended or when mom is clinically stable. So she has to be clinically stable. So if she's not stable at 6 hours, she's still in the fourth stage. She still needs like a one-on-one care. And at this point, frequent assessment for bleeding. You're frequently assessing the newborn to make sure they're transitioning. You're encouraging skin to skin and breastfeeding because that will stimulate the release of endogenous oxytocin. We're giving her some in the bag, but she's going to make her own. She's going to make a lot of it if she's skin to skin and she's breastfeeding. So that's going to help mom recover as well. And it's good for babies. They breastfeed better. All right, that's the end of this video. Thank you for watching. When we come back, we will be talking about nursing care.